Hi there, and welcome to Together for Seniors, Meals on Wheels of Rhode Island's social media video series that helps older adults stay connected. I'm Meghan Grady, Executive Director at Meals on Wheels of Rhode Island, and I thank you so much for tuning in today. I'm really excited about our show because it's with our great friend, Corey McCarty, who's our current treasurer of our board of directors and our incoming board chair. Corey, welcome, and thank you so much for joining us today.
Thank you, Meg. I'm happy to be here.
And of course, the hat that you're wearing today is your role of Senior Vice President and General Manager of Commonwealth Care Alliance, a nonprofit, mission-based, integrated care system that last year expanded to launch a health plan in Rhode Island as well as Massachusetts. So, Corey, you've been on our board for several years, and since its launch in Rhode Island, Commonwealth Care Alliance has been an incredible partner and supporter of our work. And we'd like to thank you for your sponsorship of this year's March for Meals public awareness campaign.
Thank you, Meg. I appreciate it. I'm proud to do whatever I can to help support Meals on Wheels. And I feel privileged to be able to work with you and the other members of the team at Meals on Wheels Rhode Island. Having been born and raised in Rhode Island, having parents, grandparents, and other relatives and friends that are starting to get older, it's really a personal passion of mine to find and support solutions for older adults in the Rhode Island community. And that's exactly what Meals on Wheels of Rhode Island is.
Well, let's get right to it. I'd love for our viewers to learn a little bit more about Commonwealth Care Alliance and the healthcare it strives to provide.
Yeah, thanks. That's a great question. So we are different. And as you said at the beginning, we're a not-for-profit, community-based integrated care system, really focused on coordinating care for really complex individuals with complex needs and multiple chronic conditions and significant behavioral health needs. Why that's different and why we're different is really because we're both clinician and health plan. And that's unique in the state of Rhode Island, as there aren't any other carriers that are set up that way. And really what that allows us to do is focus on care a little bit differently. So we're focused on reaching those high-risk individuals that really come with things that are what we would call social determinants of health, which is where Meals on Wheels really fits in. And so it's dealing with things like housing security. Do people have a consistent place to go on a daily basis and live? Do they have heating in their home to be safe? Do they have utilities within their home to be safe? Do they have transportation to get to friends, providers' offices, or to get to a grocery store? Do they have a consistent meal to keep them safe? And what we found is for the people that we're really trying to serve as effectively as possible, you can't really start talking medical care until you've addressed those unmet needs on the social side.
Well, Corey, thanks so much for sharing. It's really interesting, and we look forward to continuing to work with you to address social determinants of health. But let's focus on older adults for a minute. What does CCA offer them in particular?
It's a great question. It's really in Rhode Island right now, a full suite of Medicare products that come with low or no cost for many services, as well as additional benefits such as things like produce delivery on a monthly basis, dental benefits, a wellness reimbursement, telemedicine. And then we wrap around those set of benefits with some of those services that I've described. So what we've talked about in the past is really a focus on being able to get into people's homes. A lot of the members that we find specifically for older adults, and very consistent with what Meals on Wheels does, is seeing what their environment looks like. Do they have a safe environment to live in? Do they have a caregiver that's there to look after them? And services like what we offer and what Meals on Wheels offer really allow us to get eyes on our patients and eyes on our members to understand what do they look like on a daily basis, and is there anything that we need to do to intervene to make sure that they continue to be safe in their home.
Well, you just mentioned telemedicine. I'd love to spend just a quick minute talking about virtual care that's available for Commonwealth Care Alliance. What does that mean?
So virtual care really, 3 years ago, we were having this conversation about virtual care within the space of older adults. I would have said and told you utilization was very low. I would love to see it progress and be a lot higher than where it currently was. But the pandemic really flipped things upside down, and it forced us to find a way, particularly for our older adults, to get them in front of a provider on a regular basis, and also to address things like loneliness. Loneliness and behavioral health really became a challenge with the older adult population. And so for us, it just became a natural extension of how we deliver services into the home. So things that we couldn't deliver face-to-face, all of those services, checking in on the home, became virtual over the last couple of years. And in addition to that, what we saw was really an expansion of primary care and other specialists into the home through that way. And that isn't going away. You're going to see some of that retreat back to the office, because it's always best to be able to get hands and eyes on an individual in a face-to-face setting. But virtual care is really here to stay, and in particular with the older adult population. I expect we're going to continue to see this as we go forward. For us, as we think about that, we continue to offer great services. If you go on our website, www.commonwealthcarealliance.org/RI, there you can select members and you can select CCA virtual care. And what you're going to see is a lot of information around what are the types of visits that we're able to offer through virtual care. And when you start thinking about going to a virtual care visit, what are the things I need to be writing down or preparing for that visit? It's not the same thing as walking into an office where you're going to be able to show everything to your provider. And so what are the things I should be doing to prep for that visit beforehand?
Well, Corey, this is fantastic. It's been such a great opportunity to learn a little bit more about Commonwealth Care Alliance. And I can't tell you how much we appreciate your leadership in the state and everything you do for Meals on Wheels of Rhode Island.
Thank you, Meg. It was a pleasure to be here.
And for everyone listening today, thank you so much for being together for seniors. Until next time, we invite you to visit our Facebook page, our Twitter page, and our Instagram page to see our mission in action. And if you know someone that could benefit from a home delivered meal, visit our website at rimeals.org for more information. Thanks and have a wonderful day.